What if the most dangerous part of a surgery is not the disease your doctor is trying to fix, but the operation your body must survive afterward? Most people hear the word surgery and immediately think, if the surgeon recommends it, then it must be the best option. The hospital is ready, the tests are done, the consent form is placed in front of you, and everyone seems confident. So naturally, you trust the process. I used to think the same way, but after years of watching patients go into operating rooms for procedures that sounded routine, I learned something that every person over 60 needs to hear before signing anything. Some patients did not come out better. They came out different. A man walked into the hospital with severe back pain, hoping surgery would give him his life back. But after complications, he struggled to walk normally again. A woman survived a major heart operation, but the recovery stole months from her life. She faced confusion, weakness, infections, and setbacks that nobody had clearly explained to her beforehand. The operation may have been considered successful on paper, but the person living inside that body paid a price far greater than expected. This is the truth most people are not told clearly enough. As the body gets older, surgery becomes more than a treatment. It becomes a stress test for the heart, lungs, kidneys, brain, muscles, and immune system, all at the same time. The disease may be serious, but sometimes the operation itself becomes the biggest battle. And the older or weaker the body is, the harder that battle becomes. I want you to imagine two cars. One is brand new, barely used, smooth engine, strong brakes, fresh tires. The other has traveled hundreds of thousands of miles. It still works, but the engine is tired, the parts are worn, and every repair takes longer. Now imagine putting both cars through the same extreme test and expecting the same result. That would not make sense. Yet for many years, medicine often treated a 70-year-old body like a 40-year-old body, using similar surgical plans, similar expectations, and similar recovery timelines. Thankfully, modern medicine is beginning to change, but not fast enough for every patient. When an older adult goes under general anesthesia, many things happen inside the body at once. The heart must push through extra stress. The lungs may take longer to clear anesthesia from the system. The kidneys may process medications more slowly. The muscles weaken quickly during bed rest. And the brain, which many people do not think about before surgery, can become confused or foggy after the operation. Doctors call this post-operative cognitive dysfunction. In some older patients, especially after major surgery, this confusion can last days, weeks, or even months. Now, let me be very clear. Age by itself does not mean someone should avoid surgery. There are people in their 80s who recover beautifully, and there are people in their 50s who struggle badly. The real issue is not age alone. The real issue is frailty. Frailty means the body's reserve power has dropped. It means the body can still function in normal life. But when a major shock comes, like surgery, anesthesia, blood loss, infection, or long recovery, it may not have enough strength left to bounce back. That is why the most important question is not only, can I survive the operation? The deeper question is, can I survive the recovery and return to a life that still feels worth living? Those are not the same question, and every person over 60 deserves to understand the difference. The first surgery that carries serious hidden risk for frail older adults is open heart surgery, especially coronary artery bypass surgery. This operation can save lives when the right patient needs it. When arteries around the heart become blocked, surgeons create a new path for blood to flow. For many people, this can be powerful and life-changing. But the part many patients do not fully understand is how intense this surgery is on the body. In many cases, the chest is opened, the heart may be stopped, and a machine temporarily takes over the job of the heart and lungs while the surgeon works. For a strong 60-year-old with good kidney function and solid overall health, this may be manageable. But for a 7-8-year-old with diabetes, kidney weakness, memory problems, or general frailty, that same operation can become a major shock to every organ system. The body is not just healing from a cut, it is recovering from an enormous internal storm. And that is where the real danger begins. And when that internal storm begins, the danger is not always visible right away. The surgery may look successful in the operating room. The blocked artery may be bypassed. The blood flow may be restored. The surgeon may even tell the family the operation went well. But for an older, frail body, the real test often begins after surgery, in the intensive care unit, when the heart, lungs, kidneys, and brain must all recover at the same time. This is where complications can appear. Some patients develop kidney failure because their kidneys cannot handle the stress of surgery, medications, and changes in blood flow. Some patients suffer strokes because the blood vessels are already fragile. Some remain on a ventilator longer than expected because the lungs do not wake up quickly. Others experience deep confusion, agitation, or memory problems that frighten the family because the person who went into surgery does not seem like the same person coming out. This does not mean open heart surgery is bad. It means it is powerful medicine, and powerful medicine must be used carefully. For the right patient, it can extend life and relieve symptoms. But for someone whose body has very little reserve left, the operation can become more dangerous than expected. That is why no older patient should hear, "You need heart surgery," and stop the conversation there. That sentence should begin a deeper discussion, not end it. Today, there are sometimes less invasive options available. Some heart valve problems, for example, can now be treated through catheter-based procedures, where doctors work through a blood vessel instead of opening the chest. These approaches do not always replace surgery, and they are not right for everyone. But for certain older patients, they may reduce the shock to the body. The key question to ask is simple but powerful. Am I a candidate for a less invasive option? That one question can open a door that many patients never even knew existed. The second surgery that deserves serious caution in older adults is aggressive spinal surgery. Back pain is extremely common after 60. Many people live with stiffness, nerve pain, disc problems, arthritis, or spinal narrowing. And because back pain can steal sleep, movement, independence, and joy, people become desperate for relief. So when a surgeon says, "We can fix this," it is very easy to say yes. But spinal surgery is not always simple. Some procedures involve placing screws, rods, cages, or other hardware into the spine. Others involve fusing multiple levels together, meaning certain bones of the spine are permanently locked into place. In emergency situations, surgery may be absolutely necessary. If the spinal cord is being compressed and a person is losing bladder control, losing leg strength, or facing paralysis, waiting can be dangerous. In those cases, surgery may protect function and prevent permanent damage. But elective spinal fusion for long-term back pain is a very different situation. This is where many older adults need to slow down and ask more questions. Chronic back pain can come from many sources, including muscles, discs, nerves, joints, posture, inflammation, and general wear and tear. When the spine is fused, one section becomes stiff, but the rest of the spine must still move. That means the areas above and below the fusion can begin taking extra pressure. Over time, this can create new pain, new degeneration, and sometimes the need for even more surgery. And here is the part that should make every patient pause. In many older adults with degenerative spine disease, aggressive surgery does not always give better long-term pain relief than careful non-surgical treatment. Physical therapy, targeted injections, weight management, walking programs, posture correction, and pain management plans may not sound as dramatic as surgery, but for many patients, they can produce meaningful improvement with far less risk. And that is why spinal surgery should never be accepted as the only path until you understand exactly what problem the surgeon is trying to fix. Is there a compressed nerve that clearly matches your symptoms? Is there weakness that is getting worse? Is there a structural problem that cannot be managed any other way? Or is the surgery being offered mainly because pain has continued for a long time? Those are very different situations. One of the most important questions to ask before spinal surgery is, what are the chances this operation will reduce my pain? And what are the chances it will only change the type of pain I have? That may sound like a hard question, but it is a fair one. Some people go into spine surgery with one kind of pain and come out with another. The original pressure may be relieved, but now there is scar tissue, stiffness, nerve irritation, or stress on nearby spinal levels. The patient expected freedom, but instead enters a new cycle of recovery, therapy, medication, and uncertainty. This is why a second opinion is especially valuable for spinal procedures. A good surgeon will not be offended by it. In fact, the best surgeons often welcome it because they know the decision is serious. If 2 or 3 specialists agree that surgery is necessary, that gives you confidence. But if one doctor recommends a large fusion and another recommends injections, therapy, or a smaller procedure, then you know there is room for discussion. And when there is room for discussion, there is room for a better decision. The third surgery that carries hidden danger for older adults is major cancer surgery. This is the most emotional category because the word cancer creates fear instantly. When someone hears that word, the first instinct is often, take it out, remove it now, do whatever it takes. That reaction is completely human. Nobody wants to feel like cancer is being left inside the body. Families also feel pressure. They want action. They want hope. They want to believe that surgery means the problem is being solved. But in older, frail patients, cancer treatment must be judged by a bigger question than simply, can we remove the tumor? The better question is, will removing this tumor give this person more good life? Not just more days in a hospital bed, not just more procedures, not just a technically successful operation. More good life, more time at home, more comfort, more independence, more meaningful moments with family. Some cancer operations are among the most difficult surgeries in medicine. They may last many hours and involve removing parts of multiple organs. The body must handle anesthesia, blood loss, inflammation, pain, infection risk, nutrition problems, and a long recovery. A younger and stronger patient may survive that road and return to a good quality of life. But an older patient with weak heart function, kidney disease, poor nutrition, memory problems, or severe frailty may not have enough reserve to recover, even if the tumor is successfully removed. This is one of the hardest truths in surgery. Sometimes the operation works, but the patient does not recover. The scan may look better, the tumor may be gone, the surgical report may sound successful, but the person may become weaker, confused, dependent, unable to eat properly, unable to walk, or trapped in repeated hospital visits. In those cases, families often ask a painful question too late. Did we gain life, or did we only gain treatment? That is why every older cancer patient should have an honest conversation about all options, not only surgery. Depending on the cancer type and stage, there may be radiation, targeted therapy, immunotherapy, chemotherapy, at adjusted doses, symptom-focused treatment, or careful monitoring. Sometimes, surgery is still the best choice. Sometimes, it clearly offers the strongest chance of meaningful survival. But sometimes a less aggressive plan gives a person more comfort, more control, and more time outside the hospital. And the question that opens this conversation is simple. For someone my age and with my health condition, what happens if we do not operate right now? This does not mean refusing treatment. It means understanding the full picture. What is the expected course of the cancer? How fast is it growing? What symptoms might appear? What other treatments could slow it down? What would recovery from surgery really look like? And most importantly, what outcome are we trying to protect? Survival at any cost, or survival with dignity, strength, and quality of life? A serious medical decision should never be made from fear alone. Fear pushes people to move fast, but wisdom asks the questions that fear skips. In cancer care, those questions can change everything. The goal is not simply to fight harder. The goal is to fight smarter, in a way that matches the patient's body, values, and real chances of recovery. The fourth surgery that needs careful thought in older adults is elective joint replacement in severely ill patients. Hip and knee replacements can be life-changing. For many people, they are among the best surgeries modern medicine offers. A person who could barely walk because of severe arthritis may return to shopping, traveling, sleeping better, climbing stairs, and playing with grandchildren. So let's be clear. Joint replacement is not the enemy. For the right patient, at the right time, it can restore freedom. But the key phrase is, the right time. Elective surgery means the operation is planned. It is not an emergency. That means you have time to prepare, time to improve your health, and time to ask whether your body is ready. Many older adults focus only on the painful joint, but the surgeon has to think about the whole person. A knee may need replacement, but the heart must survive the operation. The lungs must handle anesthesia. The blood must not clot dangerously. The wound must heal. The muscles must be strong enough for rehabilitation. The home environment must support recovery. For someone over 75 who also has heart disease, uncontrolled diabetes, kidney problems, obesity, poor circulation, or severe weakness, joint replacement becomes more complicated. One major concern is blood clots. After surgery, patients may move less, and slower blood flow in the legs can allow clots to form. If a clot travels to the lungs, it can become a life-threatening emergency. Older adults with circulation problems or multiple medical conditions face a higher risk. Another concern is infection. A joint replacement involves placing artificial material inside the body. If bacteria infect that area, treatment can become very difficult. Sometimes it requires long courses of antibiotics, more surgery, or even removal of the artificial joint. Pneumonia is another risk, especially if the patient stays in bed too long, breathes shallowly from pain, or has weak lungs before surgery. These problems are not meant to frighten you. They are meant to help you prepare. This is where prehabilitation becomes so important. Prehabilitation means strengthening the body before surgery, not just rehabilitating afterward. It may include improving blood pressure, controlling blood sugar, building leg strength, treating anemia, improving nutrition, stopping smoking, managing weight, reviewing medications, and preparing the home for safe recovery. A few weeks or months of preparation can sometimes reduce risk dramatically. So before elective joint replacement, ask your doctor, is my body in the best condition it can be before we do this? Also ask, what can I improve before surgery to lower my risk? If the answer is nothing, just show up, that may not be enough. A strong surgical plan should include a strong preparation plan. The operation is only one part of success. Recovery begins before the first incision is ever made. The fifth surgery that carries serious hidden risk for older adults is emergency abdominal surgery. This one is different because you usually do not plan it. You do not sit calmly in an office comparing options. It happens suddenly. A bowel may perforate, an appendix may rupture, internal bleeding may begin, or a blockage may become dangerous. In those moments, families are often asked to make fast decisions while standing in a hospital corridor, scared, confused, and unprepared. Emergency abdominal surgery can be especially difficult for people over 75 because the body is already under attack before the operation even starts. Infection, dehydration, inflammation, pain, and shock may already be stressing the heart, kidneys, lungs, and brain. Then surgery adds anesthesia, blood loss, medications, and recovery on top of that. For a younger body, this is serious. For an older, frail body, it can become overwhelming. The danger is not only the surgery itself. The danger is what happens after. Some patients develop pneumonia, kidney failure, severe confusion, or widespread inflammation that causes several organs to weaken at the same time. This is why early action matters so much. If you are over 60, do not ignore persistent stomach pain, unusual bloating, vomiting, fever, blood and stool, or sudden changes in bowel habits. Waiting too long can turn a treatable problem into a life-threatening emergency. And there is one more conversation every family should have before a crisis happens. What would you want if emergency surgery became the only option? What quality of life matters most to you? Would you want every possible treatment, or would you want limits if recovery looked unlikely? These conversations are not negative. They are loving, honest, and protective. So remember this clearly. Surgery can save lives, but every major operation deserves questions, preparation, and respect. Ask about alternatives, risks, recovery, and whether your body is truly ready. If this information helped you or someone you love, share this video, write your thoughts in the comments, and subscribe for more honest health guidance.